Everybody ready? Here we go. Live in 5, 4, 3, 2, 1. Well, good evening, everyone, and welcome to our community conversation event hosted by Marin County Government and Marin Health and Human Services. I'm Lainey Hendricks, Public Information Officer, and I'm pleased to be your moderator this evening. Well, the time is actually 4:45. And no, your clocks are not wrong in your home. I just want to let you know ahead of time that this session, this community conversation, was actually pre-recorded because we know in the world of internet technology, live streams can fail. And we didn't want a technical difficulty to get in the way of you hearing this important conversation this evening. So I hope you're still enjoying this message, even though it may have taken place a couple hours earlier. I do want to reassure you, though, we received many of your questions, a lot of questions. Nearly 75 people submitted questions, and so thank you to those of you that did submit questions in advance, and we will be getting to those in just a moment. Tonight's event will be all about how COVID-19 might be affecting our more vulnerable communities, our seniors, individuals experiencing homelessness, people of color, and of course, different low-income in communities around Marin. We'll also discuss some of the resources that are available to those various vulnerable communities. Before we begin, however, I want to remind you that you can access the latest information on coronavirus activity and resources in Marin by visiting marinhhs.org/coronavirus. And that website is available in English, Spanish, Vietnamese, and other languages. So we now just have one URL for all information resources. You can also subscribe to receive daily status updates from Marin Public Health. You can do so by visiting the website and subscribing to receive those things by email, or you can certainly text message your cell phone number by texting Marin COVID to 468-311. Now let's go ahead and dive into our content. And today we announced a very important next step as we fight to limit the spread of COVID-19, and that is the announcement that we will be extending our shelter-in-place order with some modifications. And so for more information on that, we'd like to share with you a message from our Public Health Officer, Dr. Matt Willis.
Hi, I'm Matt Willis, Public Health Officer from Marin County. Next Monday, May 4th, Marin will join other Bay Area counties in taking the first steps on the long journey towards reopening our community during the COVID-19 pandemic. The current shelter-in-place order we're operating under expires this Sunday. I'm here to explain what to expect. First, it's important to know that we can only take these first steps because of you, our community, and the way we came together to agree not to come together, to shelter at home. The sacrifices you've made have saved lives and flattened the curve so far. We're in phase 1 of this epidemic. Dramatic measures to halt uncontrolled spread, successful, painful for all of us and our economy, life-saving, not sustainable forever but necessary. So here are the questions facing us. How do we begin to rebuild, knowing COVID-19 is still very much in our environment, and that the vast majority of our community is still susceptible, and some of us are highly vulnerable? We remain at risk of losing the gains we've made. So the answer is to move carefully, deliberately, and in collaboration across sectors and by engaging the whole community. These are the steps we'll be taking next Monday. May will involve a combination of small relaxations in the shelter-in-place and an interval of real preparation for the next phase of wider reopening. The changes in the order are primarily things that can be done outdoors, because we know we can more easily maintain physical distancing, that these settings are lower risk for transmitting the virus. Outdoor businesses like nurseries will be allowed to engage with the public outdoors. Landscapers, gardeners, and others that provide outdoor services can resume work. Construction projects can resume as long as they meet state guidelines and follow the protocols detailed in the order. Outdoor activities like golf and non-contact sports, where physical distancing is possible, can resume. Childcare will be permitted for all persons who are now able to work under the new order, following guidelines established in the first order. Outside of these new measures, everyone should continue to stay home except for other essential travel, such as going to the grocery store or pharmacy. When you go out in public settings, anyone over the age of 12 must wear facial covering over their nose and mouth. While we are lifting some restrictions, it is important to remember that the state sets the floor in terms of how much we can roll back any element of the shelter-in-place order. These changes reflect that the shelter-in-place order is not an on-off switch. The number of activities we can engage in, while the general rule is we are remaining sheltered at home, will increase slowly and sequentially over time. The number of businesses that may come back online, and when, is based on the ability for them to conduct business safely for both customers and employees. We will move away from the designation of essential versus non-essential and begin seeing businesses or activities as either lower risk or higher risk for COVID-19 transmission. To navigate this delicate process, the County of Marin has established a recovery work group called Marin Recovers that will be part of an effort to continually reevaluate orders based on the status of the epidemic at any given time and our capacity to move forward safely. This effort will consist of the public health officer, a healthcare preparedness program, and an industry advisory group to establish safety standards for a safe reopening of our economy. Industry work groups are being formed consisting of 5 to 8 industry representatives to advise and develop recommendations for standards to safely resume work with public health guidance. Weekly progress reports will be provided to the County Board of Supervisors Subcommittee during this process. To set expectations, the Governor has indicated that the rebuilding process statewide will occur over months and not weeks, and that's likely to be our experience here in Marin as well. These are the indicators public health will be tracking to ensure we can move forward safely. First, we need adequate COVID-19 testing capacity. We're building testing capacity to ensure cases are detected as early as possible. We estimate we need 500 tests per day at least. Second, we need the ability to isolate and quarantine cases and perform contact investigations. Our goal is to successfully reach and isolate or quarantine 90% of cases and their contacts within 24 hours moving forward. Third, medical facilities must be able to handle surge. We've been engaging our healthcare partners to ensure they can safely manage COVID-19 cases and potential surges. Fourth, monitoring trends in transmission and surge. We have to have a system where we can actually track our progress and the local spread of disease. We will be tracking respiratory illness cases and other indicators of potential COVID-19 activity. A measured reopening will require an unprecedented collaboration of healthcare leaders, industry, and government. Some may feel we're moving too quickly, especially as we see more cases of COVID-19, which we expect to some degree. Others will feel we're moving too slowly. Our role is to find the balance, using the best available science and with the guidance and partnership of business, educators, our elected leaders, and you, our community. On my end, we're learning more about this virus every day, and we'll apply that knowledge to this process. We've seen what we can accomplish when we move thoughtfully and together. We're going to need to rely on that same spirit to get us through this next chapter as we navigate the hard choices facing us. Thank you all for all you're doing to keep yourself, your family, your neighbors, and our Marin community safe.
Thank you, Dr. Matt, for that important update on the new shelter-in-place order. If any of you watching from home have questions or want to review the new shelter-in-place order that goes into effect on Monday, May 4th, you can access all of that information online at marinhhs.org/coronavirus. And now let's get to the heart of our conversation. How is COVID-19 affecting our vulnerable populations here in Marin County? And I'd like to introduce to you our two experts for the evening. first Dr. Benita McLarin, who is the Director of Marin County's Health and Human Services Department. Welcome, Benita.
Thank you.
And we'd also like to welcome Dr. Lisa Santora, our Deputy Public Health Officer. Thanks again for joining us.
Of course. Good evening.
So, Dr. Lisa, I'm wondering if you could start us off by giving us a brief update on COVID-19 activity here in Marin County.
Of course. We continue to see COVID-19 activity increase in the county, and that's to be expected because we're testing more. This evening, we have 235 confirmed cases of COVID-19, and now we have more than 13 deaths. The good news is that we are seeing people recover. Our nurses contact every individual who's tested positive, and we have more than 160 people reported recovering from COVID-19. But again, this is a critical time for us. We have gained significant wins with shelter in place, but our target right now is really focusing on our most vulnerable populations and making sure that they're protected as we move forward in the months to come.
Great. Thanks for that quick overview. Now, Benita, almost, right? I want to shift to your department, which is the largest department for the county. I know that you have teams working in a number of different ways to come alongside some of our neighbors, not only the older adults that Dr. Lisa referred to, but other key communities in Marin that might need some extra support during this really difficult time. So would you like to start off our conversation by giving an overview of some of what Health and Human Services has been doing in our communities alongside our community partners to support these vulnerable communities?
Yes, thank you very much, Lainey. I'd really appreciate the opportunity to come before the residents of Marin County tonight and give an overview of some of the work that's being done in Health and Human Services. I do have some prepared notes. I'm going to go ahead and go through some of those. I want to let everyone know that the impact of COVID-19 has been swift, has been painful, and difficult for our entire community. People are experiencing challenges with people that experienced challenges with life prior to COVID-19, and communities struggling with historic inequities have been further impacted by the economic devastation and the disproportionate health and social economic effects of the pandemic. Over the past 57 days, the Health and Human Services Department has been working with other partners and with other staff from the County of Marin and have become more nimble, resilient, and steadfast in our approach to supporting our most vulnerable populations while providing resources for all Marin County residents. Keeping our strategic plan in mind, Health and Human Services is creating an infrastructure to support the shifting needs of residents of the county during this pandemic and beyond. This response includes identifying needs, dismantling barriers, adjusting policies and practices to be able to provide continuous services, addressing the needs of the current and new clients seeking support countywide. Many of our most vulnerable populations, including communities of color, African Americans, Latinx communities, low income, seniors, and other residents are not only suffering greatly because of the great opportunity to potentially contract coronavirus, the greater health impacts that they may have after contracting coronavirus, lack of access to health care, but also because of the disproportionate share of these communities work in service industries and live in crowded living conditions. In times like these communities experience the greatest fears, also including helplessness and hopelessness. Historically, vulnerable and newly impacted communities in need of supportive services that might meet them where they need at the moment, while adjusting for the ongoing changes due to job loss, health concerns, and school closures. Health and Human Services acknowledges the ever-changing landscape of this pandemic requires us to keep a keen focus on equity, along with our community partners to continue to respond in this unprecedented event. The impact of the coronavirus COVID-19 pandemic on Marin residents has deepened the need for those already experiencing equities and vulnerability, and for those newly experiencing loss of income. Being a director of a joint agency that covers public health, social service, and behavioral health and recovery, during this crisis has been very humbling for me. And I see the impacts on our community with a bird's eye view, understanding much of what's happening. Weighing the impacts from all vantage points is difficult, and I'm constantly reminding our staff of our mission and our goal to promote and protect the health, well-being, and safety and sufficiency of all county residents of Marin County. We've been here to serve since the beginning, and we'll continue to be here throughout this pandemic and afterwards. The most visible department during the pandemic crisis, though, has been our Stellar Public Health Division. They're on the forefront of identifying the virus coming into our community and notifying us all. They've worked tirelessly in collaboration with our County Public Health Information Officer to make sure information flows regularly and timely. And we're proud that our public health team has developed the first state drive-through test site and has tested over 1,300 persons to date. And they're continuing to set the standard for testing as they begin to expand their testing. Testing is really important for all of us to understand that because it allows us to know where the virus is spreading. It allows us in identifying persons who might need healthcare. And the goal of testing is to ensure that the safety and health of our individuals, families, and communities. We know underserved communities are somewhat hesitant to have testing, but we want to reassure everyone that testing is confidential, it's safe, and important to the overall health of our community. Our communicable disease branch, part of public health, has been instrumental in providing support to COVID-19 positive patients and their contacts, as Dr. Lisa mentioned. Public health works diligently with our hospitals, skilled nursing facilities, long-term care facilities, residential care facilities to ensure they have the resources they need. They work with our federally qualified health centers to ensure that access to care remains available. And we're really proud of our newly developed call center that's been working day and night to make sure that questions are answered regarding COVID-19. Our Women's, Infants, and Children's Program, part of public health, continues to provide nutrition support for more and more mothers and babies as they strive to stay healthy and strong. One of our biggest goals during this event is to ensure food access for a large senior population, partnering with our community-based organizations to ensure vulnerable older adults living alone cannot leave home have access to food during this pandemic. We've utilized grant funding for grocery delivery, and we've increased our capacity for deliveries to homes. We've established food liaisons for our underserved geographic communities to ensure equitable access in West Marin, Marin City, Canal, and Novato. And we've established partnerships between social services and the Marin County Office of Education, providing meals to students who have been affected by the school closures. Most substantial in this effort is that the need that we have ensured broad community-based organizational support and information sharing for food distribution and food resources, working with over 65 partner agencies such as the Food Bank of San Francisco and Marin, Bayside, MLK, Whistle Stop, Canal Alliance, Northern Marin County Community Services, and more. I just want to let everyone know that on April 24th, the governor and the State Office of Emergency Services announced that the first county restaurant meal program for older adults and those others at risk. And this program is going to include 3 home-delivered restaurant meals for those living alone and those who don't have ability to prepare their own meals. Those on CalFresh, Meals on Wheels, and other federal programs will not qualify for this program, but we are waiting further guidance from the state how to implement this program locally, and we're very eager to get it started. So just stay tuned for that new program. Our Aging and Adult Services program continues to receive calls, increased over 25%, to making sure that our seniors can stay well connected and that they are receiving the care and support they need. Our in-home supportive services continues to provide in-person visits and to make sure that those over 65 and those with underlying health conditions continue to get welfare checks and additional resources. Our public authority continues to make sure, IHH Public Authority continues to make sure that we are having emergency backup support for any of our providers that are not able to conduct their services. Our ombudsman program continues to make calls and concern to residents and family members living in assisted and skilled living facilities. And of course, we continue with our outreach to our other licensing agencies, residential care facility administrators, and others in need of support. Our general relief program through social services also has seen a tremendous increase in demand, and our staff is working to approve cases in record time. Our call center is processing hundreds of calls a day for public assistance applications, and staff are working tirelessly to meet the demands as well. The demand on our public assistance program has expanded and increased fivefold, and over 100 staff continue to provide services to meet the increased demand, including informing recipients of state increases in CalFresh and CalWork subsidies and the availability of CalFresh now for SSI recipients. The other great news is our EBT goes online at the end of this month and early May, which is going to allow our recipients to order food online from Walmart and Amazon, which is a great new service. One of the amazing opportunities is our partnership between social services and our behavioral health and recovery services to assist our clients who are experiencing great stressors during this job loss and family challenges, and they're using a trauma-informed approach. We're training social services staff to be able to accommodate people who are facing mental health crisis. And we're also working diligently to support our undocumented residents affected by COVID-19, ensuring available funding gets out to these communities. Regarding the public charge, we're addressing fears created by the new public charge rule by making sure that our communities have support that they need. The California Immigrant Resistance Fund has been established, and it soon will be providing funds for undocumented undocumented members of our community. Our Children and Family Services has seen, unfortunately, about a 50% decrease in our responses. And we really want to put a call out to all residents of Marin to make sure that we are taking care of our children. Our staff are present and they're on the front lines, ready to take care of our needs for our children. And they want to make sure that we are making those calls to identify where children may be in need. Despite our shelter-in-place order, we're working hard to keep families together who are in crisis and ensure families who have been separated continue to have visitation opportunities. Our employment and training team has been working to make sure that employers and employees who are undergoing layoffs and have needed assistance are provided with the information they need for filling out unemployment insurance claims. As you can imagine, our claims have jumped dramatically from over 600 claims in February to over almost 9,000 claims in March. And we're predicting or expecting even more for April. We've been conducting rapid response events with the Workforce Innovation and Opportunity Act, and we've been providing assistance with these unemployment claims. Our care and shelter homeless support program has been working tirelessly to help put the high-risk homeless populations into hotels, motels, and RVs. As of this past Sunday, we have already placed over 120 persons into shelter, along with the residents that have already been in our shelters in Marin. We are really working to make sure our staff are trauma-informed training and that they're able to work with the homeless populations. We're also providing hygiene stations in unsheltered locations in San Rafael, Novato, and West Marin, and providing access to mobile phones to our homeless population. Most people know about our Real Assistance Program that's had some great success in Marin County, funded by a collaboration between the County of Marin and the Marin Community Foundation. The 2020 Rental Assistance Program has been a partnership of multiple agencies across the county, from Ritter Center, Adopt a Family of Marin, the county, the Community Action Marin, St. Vincent de Paul of Marin, North Marin Community Services, and Community Action Marin, in terms of ensuring that rental assistance funds get distributed throughout our county. Our grants are available to all residents of Marin, but we're prioritizing those at 30% area, medium income, and below. In the first week of the program, we received at least 1,500 requests, which exceeded the amount of money that we had available. And we're fortunate that the fund has been increased to about $1.6 million. I'm almost done with my comments, but I do want to make sure that everyone knows our rental assistance program as of today has had 360 grants issued, and an additional 348 grants are being processed. And then finally, I want to talk a little bit about behavioral health, which is a critical resource during this time for our community, which is during a very stressful and difficult time. We've seen, however, some drop in the number of our clients. And again, it does bring us concern, and we want to let our community know that we are still here to help you. We are working day and night to make sure that services are provided for mental health needs. We've partnered with the Body Heart Community Radio and providing information on COVID-19 resources to Spanish-speaking community. We've translated Spanish-speaking parenting group to virtual, or transitioned the Spanish-speaking parenting group to virtual meetings. We're using grant monies to pay for sober living environments for COVID-19 related unemployment. We've responded to an increase in mobile crisis calls, and we are available in person as needed. In our county jails, our behavioral health staff continue to provide our usual services with our clients, including screening and evaluation on admission and informing clients of procedures to request services. We conduct weekly rounds of needed interventions for our mental health clients, and we're providing support to our clients around the stressors related to the virus and concerns for their personal well-being and the well-being of loved ones at our jail facilities. We're rounding in our restrictive housing units several times a week. And I just want to close in saying of my notes or of my comments that throughout this difficult time and challenging time, the staff of the Health and Human Services Department and our partners in the community remain committed to service to our community and committed to the vision of our equity strategic plan. During these times, we remember why we got into this work, and that is to help and serve others. We are glad to be able to do what we're doing, and I'm proud of our great teams and all that they're doing every day. This is just the tip of the iceberg of some of the great efforts by our Health and Human Services staff to support the community during this time. And our staff recognize the importance of our work, and that now more than ever, our work is critical to support our most diverse and vulnerable communities in Marin and all county residents of Marin. Thank you very much.
Well, thank you, Benita. That was fantastic. And frankly, I feel like you covered a number of the questions that our residents submitted earlier. I'm struggling for which the first question is, I may ask, although listening to all the various groups that you covered, there's one group that stands out that a few people actually asked about, and that's our incarcerated community. And I'm wondering what support services Health and Human Services might be providing alongside our law enforcement partners to those that are in the jail.
As I mentioned, thank you, Lainey. As I mentioned, we already provide, as part of our work in Health and Human Services, we have a great partnership with the jail. And we do have our public health staff as well as our behavioral health staff that work regularly in the jails and making sure that the clients in the jail get the best health care as well as the best mental health services that there is available. And so I think that we have definitely increased our surveillance in the jails on the health side, as well as our surveillance in terms of mental health, and to make sure that the clients there have the services that they need.
That's great to hear. So you mentioned some great work with community partners, especially as it may impact our communities of color. And I'm wondering, and this might be a two-part question for both of our lovely panelists this evening. As we look at the topic of equity, we touched a little bit about this last week as well. we are hearing reports across the country that COVID-19 is disproportionately affecting our communities of color. And you did touch on that, not only in terms of access to healthcare, but how it may impact those households with needing to go to work and serving in essential service roles. So I'm wondering if you can elaborate a bit on those touch points and how you maybe are going about reaching out to those that might be unsure about things like testing or seeking medical help, especially those that might be undocumented representatives here in our community. And then Dr. Lisa, perhaps you can share a bit more if there are any special efforts underway in our community, just in a general sense, all of these individual communities around Marin, to make sure that we're getting the word out about testing.
I think it's a great question, Lainey. I really appreciate your asking, because it is a concern of ours. We have seen across the country that communities of color are being disproportionately affected by COVID-19. And as you, I'm sure, have read, is that it's a tremendous concern, because a lot of, especially African American and Latinx communities, sometimes come to this with underlying health conditions. Sometimes there is a disproportionate share of people who are low income, that they live in more congregated areas. They may have more difficulty getting to accessing healthcare. They may not have even the information that they need to make informed decisions. So yes, it is a concern for us to make sure that our communities receive the information and the care that they need, and that we are reaching out to our communities and being proactive. And we're trying to also respond to, we have also been contacted by a lot of community leaders, and we're trying to be responsive to those calls and to that need. Yeah, we definitely recognize it's a real issue. And I think Dr. Lisa can talk about some of what we're seeing in terms of the population impact so far, but also some of the specific testing plans that we have, as well as some of the other things that we're doing. But certainly we're reaching out. We're trying to make sure that we provide different services, as I mentioned, around the food resources, around the information, in terms of education, and other things that we can do to prepare all of these communities.
And I can jump in too. Data has been very important for us throughout this entire pandemic. And we have now, I'm proud to say that our community epidemiology team has worked hard to ensure that we have data based on race and ethnicity, to ensure that there is parity in our approach to identifying, diagnosing, treating, and connecting all residents in Marin to the services that they need. Up until this point, we're seeing testing happening equivalent to our demographic profiles. So we're not seeing under testing among any particular race or ethnic group. We're also not seeing differences in hospitalizations or outcomes like death. Unfortunately, though, what we are anticipating that we're seeing, and we're seeing clues that that is happening, is that we're going to start seeing a shift into our low-income communities, as well as our communities of color, in the diagnosis of COVID-19. And that's because we see a lot of our low-income workers, those who are essential workers, for example, working in our grocery stores or as home health care aides, who already have been under-resourced and don't have access to services, have already been on that front line and have had exposures to COVID-19. And that's what I mentioned previously, that we're starting to see small clusters that are concerning to us, and which is why we need to double down on our testing and engaging the community and increasing their awareness about the importance of testing and building trust with our community so they access the testing resources that we need. And most importantly, is providing the social supports and resources so when and if they do test positive for COVID-19, that they can maintain their housing, that they can maintain their employment and continue to support their families.
That's a really good point. I know that, Benita, you had mentioned in your report, as it relates to individuals that are experiencing homelessness, that the county has been able to provide isolation to those who need it. What is the county providing? Is that the only vulnerable group that has access to that resource, or are things in the works to make something like that available to maybe those communities, Dr. Lisa, that you mentioned that are a multifamily household or something like that?
Absolutely. We are working very closely now to make sure that the resources that Benita described earlier are available to those families and households that test positive for COVID-19 or have to be placed under quarantine for COVID-19. In the beginning, most of the people we contacted who were diagnosed had small family households, had sufficient bedrooms and living space and bathrooms to ensure appropriate isolation and quarantine. And now what we're seeing as it shifts into lower income communities due to crowded living conditions, that we are unable to provide the isolation and quarantine support that they need. And which is why we're working to make sure that the resources, the hotel resources that were described earlier, are available to this community as well.
That's great to hear that those efforts are underway. On the topic of testing, and I know it's top of mind every week now. It has been our number one category of questions is various questions about testing. I'm wondering if you can, Dr. Lisa, share with us what is that current criteria for testing? Who should get testing? We talk about the importance of making sure that ongoing testing is happening. And, you know, I'm curious, is the demand for testing through the roof, or do we need more people to come forward? And how should that work?
Well, fortunately, shelter in place has been effective. So we've seen in our data, we've seen significant decreases in respiratory illness and ER visits for respiratory illness. So that is a good news. So I think there's not as many symptomatic people out there, but we do know that COVID-19 is transmitting in our community. And as many people have seen, one of our key indicators for lifting shelter in place is ensuring that we have significant testing expansion in our community. And we've been working to do that in order to ensure that people have access to testing. This week, we piloted for the first time self-referral for testing for Marin City. And we'll be doing that in partnership with Marin City Health and Wellness and our other federally qualified health centers. So people have access to testing and we can do it in a location near them. So there's less barriers for testing. We are also going to be piloting self-referral for essential workers. And I mentioned this earlier, there's been people that have been working in our community before face covering became the norm and have been exposed to COVID-19 and may be unaware. We have, when we recently tested a group of household contacts, and we tested it because of the type of exposure that they had to an essential worker, all of the household contacts we tested were asymptomatic. And that is, again, revealing how this disease is going to continue to transmit in our community. So our next step in the pilot will be expanding that self-referral for essential workers. This week, we're focusing specifically on staff of the skilled nursing facilities and residential care facilities for the elderly, where we've seen high numbers of cases and outbreaks in these facilities. And once we ensure that we can meet the needs of this group, we'll be expanding it to other essential workers, starting first with healthcare workers and first responders who are asymptomatic. So they have the opportunity to test their status, and then expanding it further to essential workers who are still identified in our shelter in place order as essential businesses and making sure they have access to testing.
And those would be, for those that are watching, our grocery store workers, correct? And those essential businesses that are still operating and they need to go to work, those would be defined as essential workers in that regard, yes?
Absolutely. And the other thing that's coming online that we're really proud of is we'll have a partnership with the California Department of Public Health. Many people may have heard of the Governor's Task Force on Testing, and we'll be bringing a testing site into the Canal District of San Rafael and be working in partnership with our community-based organizations. Like Benita mentioned earlier, these organizations are critical for all phases of our response to this pandemic. And in partnership with Canal Alliance, Multicultural Center of Marin, Marin Community Clinics, and our larger voluntary organizations active in disaster, we'll be working to make sure our vulnerable populations, those prioritized populations, have access to testing. And I'm already proud, as you mentioned, we've already tested more than 3,000 individuals in Marin County, and we're looking to expand that, and as well as expanding our contact investigation support. So if someone does test positive for COVID-19, our team is ready to provide the supports that they need.
So tell me a little bit more about that contact investigation. I know we did receive a few questions on that, and two parts. So how crucial is that in our tracing efforts? And then secondly, if there's a retired nurse out there that wants to roll up their sleeves and contribute to the good work that's happening, how do they get connected with that effort?
This is probably one of the second most important step for us in public health, is building that public health workforce. As Benita mentioned, and the numbers are disheartening, I think, to hear the numbers of people who are unemployed in our community. We do need to start building a public health workforce, and that will be our new normal. And hopefully working with residents in our community who have been affected, especially in communities of color, and ensuring that when we embark on contact investigations, we have a robust team of people who have been trained in contact investigations. And that's not just nurses; it can be lay people who have been trained. So that's a place that we're growing. And what a contact investigation is the way we really can control the spread of this disease. And every person who tests positive right now is contacted by a nurse on our team. If you are a nurse and interested in volunteering, you can join our Marin Medical Reserve Corps. And we're building out that team right now. It used to fall under one section, and our organization structure is growing significantly. And this is the space that we're expanding the most, is to make sure that we have the staff who are trained, who are trauma informed. When we first started contact investigations, they were short interviews. If you can imagine, we had many affluent travelers who were returning to our community. And now as the disease is transmitting across Marin County, and we're going to see it disproportionately affect our low-income communities of color, our contact investigations are more complex. The households are more complex. There's language barriers, there's literacy barriers, and what used to be a 15-minute interview are now an hour-long interview. And I think that shows the depth that we need to have, again, to not only help individuals who are test positive for COVID-19 understand what they need to do with isolation and quarantine, but again, going back to making sure that they have the resources and social supports they need to maintain that quarantine.
Excellent. Thanks for that clarification. Mm-hmm. Well, if you are just joining us on one of our broadcast TV partners, this is our community conversation event hosted by Marin Health and Human Services and the County of Marin. And our two health experts that are joining us this evening are Benita McLarin, who is the Director of Marin Health and Human Services, and Dr. Lisa Santora, our Deputy Public Health Officer for Marin County. So I want to jump back into questions. We had quite a few having to deal with concern of access. And Benita, you mentioned earlier in your remarks the efforts that were made to provide rental assistance. This question that came in is a bit related, and I'm wondering if you can maybe elaborate on that effort with this. And the question specifically is, how is the county engaged in terms of reaching out and finding those individuals that might be at risk of losing their housing, and also those that might need those special services? I hear there's a lot of effort in working with community-based organizations to help deliver those services, but I'm wondering if your staff is taking it at an approach where if they come to a touch point for food, for instance, they are provided an entry point to other services. How does this work? Enlighten me. I've never been in this situation that many of your workers, so we'd love to hear more about how this works.
Yeah, it's a great question, Lainey, and we are really trying to be proactive in terms of getting information out about all of our services. One thing that we have done is to provide flyers with our food outreach program about all of the different services that we have. We are trying to be really active with social media, as well as with our own, as with you, and posting things on our county website. We're working really, really closely with our community partners to make sure that the information gets spread countywide. So yes, we are really trying to be intentional about getting the information out, and also proactive. And we want to be creative, and so if there are other ideas, we're open to those. But yes, we have tried to really look for those opportunities to make those connections and make sure the information is getting out there. And certainly working even just with the media in terms of getting information out. We've seen some great increases in our number, and I want to put that number out there that folks can call us to get information, and that's 415-473-7191, 473-7191. You can call the COVID-19 information number and get answers to your questions about any of our services.
Excellent. Another hot topic among the various questions that were submitted comes around the concern for the elders in our community. And there was one particular question that stood out, which was how can the County of Marin and also our residents help our care facilities and retirement communities to protect these elders without having to isolate these individuals indefinitely? And Dr. Lisa or Benita, I will let you decide who wants to dive in, but it is an interesting question.
This is probably one of the things that weighs most heavy on me, is because as we age, social isolation becomes so detrimental to our health and well-being. And in order to protect the residents of our skilled nursing facilities and residential care facilities for the elderly, we've had to put significant limitations on visitation. And so family members and friends have been unable to connect and to touch and to hug loved ones. And at this point, we are beginning conversations around how can a facility or a community that has a lot of vulnerable individuals continue to cocoon and protect these most vulnerable individuals. And this is not going to be an easy pathway out. I think this is where testing, as testing expands, becomes important. And then I think it's also continuing to allow us to buy time. So treatments and vaccinations and those things that can, again, make sure that when we do visit our most vulnerable communities, especially these congregate living facilities, that visitors who are entering are not bringing in disease, which is what has happened in these communities. And I think what our facilities are learning is, again, just what infection control procedures need to be in place to get back to a new normal. And that's what we're going to be seeing across the community, from small businesses to parks and to these facilities, is trying to create new standards of infection control in order to ensure that we can begin with having more social connections, especially for groups that are definitely affected the most by having being isolated.
Can I just add that, we do have several programs going on throughout the county where we have phone calls being made to our seniors in their skilled nursing facilities and residential care facilities, and even at home. I know there are even some high school students who are making calls. And I think really just those opportunities to reach out and make those connections are really, really positive and really valuable. And as Lisa mentioned, really important. So those opportunities to just make a phone call, if you know, if you have relatives or friends, please go ahead and make those calls. I think that goes a long way for our physical health and mental health, having those connections.
And you brought up mental health, and I think this is a good segue here. You've also mentioned the efforts of the Behavioral Health and Recovery Services Division of your department, Benita, and the work that they've done. Now that we are at week 6, I've lost count, but now we have, definitely 4 more weeks of a shelter-in-place order. Does that change anything for your behavioral health teams in terms of increasing their presence in the community or changing any tactics that they might be utilizing to reach those in the community that might be feeling the immense weight of this shelter-in-place order?
One thing is true that one thing that is the case, and that we have really expanded our use of technology in behavioral health. We have really done a lot of work with telemedicine that we, had only touched the surface previously. This event has really caused us to be more creative, innovative, and to really expand our reach. And so there's definitely been some pluses of being able to do that, and some minuses where we do see in some situations where people would benefit better from face-to-face, and that the telemedicine isn't preferred. And so we are going to be looking at how we can do more physical outreach, even though we're going to be limited in that. But for those folks who really may be in crisis, we may be doing a little bit more looking to reach out to them. But we are really happy with some of the use of the technology, which allows us to continue the shelter-in-place order, but also be able to continue our connections with our with our clients in behavioral health. And I think that, expanding our group services using the technology is also something that we're going to probably be spending more time utilizing.
That's great. And if somebody in the community, maybe somebody even watching tonight, who is feeling the weight of this, whether they're a parent who's had enough of their kids, or maybe they're feeling the economic burden of this, is the phone number that you mentioned earlier, is that a good starting point for them to be able to be connected, or are there other resources we should share with everyone this evening so that they can take advantage of the great mental health resources that your department offers?
I would say it's both and. I would say that is a good place to start, and that is the 473-7191 number is a good place to start. And the good folks on those calls will connect you to our behavioral health and recovery services, or you could go on our website and get the direct phone numbers to our services. I definitely encourage folks during this time not to take these how you're feeling lightly. It's not unusual. It's not something to be ashamed of. We're all going through tremendous difficulties, and I really encourage our community members to take advantage of our great services. We have people standing by, wanting to help and wanting to assist, and knowing that this is a difficult time. So please take advantage of the services and the great positive folks that we have here in Health and Human Services.
Thank you for that, Benita. And maybe as we start to wrap up our conversation this evening, you can also share with the audience, what are some other resources that those that are struggling might be able to find by calling that 473-7191 phone number. I think you had mentioned earlier food resources, but again, anybody that's struggling that might need some support, what can they find there?
Yeah, I would say that, anything that you need, we can get you directed to the right place. Right now, they're taking mainly calls about rental assistance, food subsidies, they can answer questions about COVID-19 in terms of, where you can get testing. They can get you information about, symptoms that you may have. We have a pretty robust group of people who are have been well trained and able and willing and interested in helping you. I would say though that I do want to remind folks they're open right now, I think 9 a.m. to 12 and then 1 to 5 p.m. But if you call at a different time and leave a message, they will call you back. They will call you back. So feel free to call anytime. And if you don't call when the hours that they're open, they will call you back. But yes, they can answer your questions, or they will get you to the right place for your resource needs.
That's excellent. And those services by phone are available in English and Spanish, correct?
Yes, thank you. Thank you for the reminder. Yes, we have bilingual phone answers as well. Thank you. Yes.
Perfect. So I think we have time just for maybe one or two more questions. I do want to circle back to the topic of testing, because there was a question that I failed to follow up with, and that is there's a thought in the community that one has to pay to get tested, or there's some sort of insurance copay, or you must have medical or health insurance to be tested. So is that actually true, and how does that affect our low-income communities or some of our vulnerable communities that we're talking about this evening?
So all testing offered by public health is free. It is free. There's no copay. And there are places and venues where people may go to another healthcare facility, and they will collect information about their health insurance. The state-based testing that we're going to be offering, and I just reviewed the rules today, they will also collect information around health insurance, but anyone who does not have health insurance will not be charged anything and will not be billed for testing. So testing is free for anyone who does not have health insurance in this community.
And is there any citizenship information that's collected as that process is done?
No, we collect your name and your date of birth and a phone number to make sure we can get back in touch with you. We are collecting on self-referrals. Your employer And I know this might bring some concerns to individuals around self-referral and notifying their employers, but that's important for us, again, as part of the contact investigation, because we know it's usually among your colleagues who you're having close exposure to. So we want to be able to provide the supports to your employers and your colleagues if you do test positive. And so that's nothing to be fearful about providing that information. And we are collecting information again around race and ethnicity. The only way that we can monitor and ensure that there is not inequity in our approach, either in diagnosis or in treatment, is by having information about the racial and ethnic demographics of people receiving services in our community.
And is that data available to the public?
Yeah, so we do have, go to our website. You can show the website again, and there are links to our surveillance data. And just this week, we have updated our regular surveillance report with information around race and ethnicity and how it's affecting different communities. I know there's a lot of inquiries about providing specific town-based information, and those are small numbers for many of the towns and jurisdictions. And for that reason, we are not yet releasing town-specific information. But as unfortunately, the test will grow positive, we'll have more COVID positive tests, and we want to provide the information to the community. And we've seen tremendous improvements on how we're communicating our data and making sure everyone is up to date on the latest information around COVID-19.
Terrific. And for our last question, I'm going to change it up from previous town halls. If there is someone watching that fits one of those vulnerable communities that you've defined out there, is there a message you'd like to share with them?
You know, I would like to say, as per the songwriter, singer, and musician, Alicia Keys, this goes out to the most vulnerable. I hope you remember that you're strong, you're brave, and you're resilient, and you can beat the odds, and you will rise and you'll make it. And I want to say thank you for all of our citizens, our residents, all residents of Marin County for everything you do every day to make us a great county.
That's awesome. I can't top that for sure. That's a great ending. And I do think I think it's well deserved to give a hats off to the many individuals that are helping to make this work possible, whether they be county employees, local city town employees, the numerous community-based organizations that Benita named off during her opening remarks. They say it takes a village, and it's very heartwarming to see that the various aspects of Marin are able to come alongside these vulnerable groups and support them during this time of crisis. So that is a very, very wonderful thing. Well, thank you so much, Benita McLarin and Dr. Lisa Santora, for joining us this evening. This has been a really informative and encouraging conversation about how we are supporting our neighbors here in Marin County. I do want to remind everyone, if you have any questions about COVID-19, you are welcome to call the phone line that Benita referenced. That's at 415-473-7191. It does operate from 9:30 to 12 and 1 to 5, Monday through Friday. But as she mentioned, you are able to leave a message, and our call center team does get back to you when they are back in the office that next business day. So do know that you are able to reach out at any time. We also have our up-to-date website, which is at marinhhs.org/coronavirus. And there you will find a really detailed, frequently asked questions section on just about anything you would want to know about the coronavirus, as well as the new shelter-in-place order that will be going into effect on Monday, May 4th. And if you are curious about seeing that data that Dr. Lisa Santora referenced, broken out by age, gender, race, and also geography around Marin, do visit that website, and at the top you'll see a tab that says data. Click on that and feel free to dive into Marin's COVID-19 data. That page is updated daily. So with that, I'd like to thank everyone for watching, and to remind everybody that you can subscribe to receive daily COVID-19 updates by texting Marin COVID to 468-311. And you'll receive a daily update from Dr. Lisa and Dr. Matt themselves every day. So again, thank you for watching. We plan to bring another community conversation to you again very soon. Thanks again for your patience with our pre-recorded version. I hope you do enjoy it, and we'll be back live again soon. Until then, have a great evening and stay safe, Marin.